Thank you so much for having me. It's really, I think, valuable to have the perspective of policy and law, but how often do public health, medical, the world of medicine, and the law come together? I'm not super sure. So I'm really humbled to be in the company of such an esteemed panel, but also to be speaking to all of you about something that I'm somewhat new to, but care deeply about. So despite my background in organizing and running campaigns on behalf of low-wage workers, I'm somewhat new to the world of immigration. I'm 1 year in as deputy director at CIPC. It has felt like 10. In 2016, I was with the National Domestic Workers Alliance, where I focused on organizing domestic workers all across this country, and in particular worked on 6 campaigns to make sure that there were domestic workers' Bill of Rights, because domestic workers are excluded from FLISA. I raise this because when I transitioned to CIPC, I realized that every issue that we deal with in immigration is somewhat grounded in something else, because I came rather intimidated, to be perfectly honest. So a little bit about what CIPC does. CIPC is something between a think tank and an organizing hub. We organize folks up and down the state for statewide campaigns, most of which are tethered to legislation, and we counsel on impact litigation. As a general matter, health equity is just one of 3 buckets that we work on. In addition to health equity, we work on detention, deportation, and economic justice, and I will try to raise some of the issues that overlap in our conversation tonight. I'm going to be focusing a lot on both the federal immigration scene, but more specifically where I'm grounded and I work, which is California's answer to a really difficult moment. I've had to learn states' rights backwards and forwards in a very short amount of time. Before I get to the substance of what I wanted to talk to you all about, though, I wanted to tell you that I just described my day job. Let me describe my side hustle, which is not this slide. So I was thinking about what I wanted to share with a group of wonderfully invested folks who work in public health, where I work in law, policy, and run campaigns. And sometimes these are communities that should speak more, but they don't very often. I will tell you that the health effects of the moment that we're living in are they sort of cascade from the larger campaigns in which I work, which I'll explain and talk to you more about, to literally the staff that I work with at CIPC. So last night I was busily trying to get the presentation that I have to you and thank you, Yael, a deep thank you for having us and coordinating this panel. I meant to say that at the beginning, but my mic was freaking out. To the organizers, and I got a call that kind of stopped me in my tracks. Someone I work with disclosed both their status as well as their parent status. I wasn't aware, and I don't ask those questions when someone starts, and was in desperate need of legal guidance literally in that moment because of something that had happened. When I think back over the last 2 years, a lot I think of what lawyers and professors, medical providers, perhaps professors, I don't know, folks in the world are doing is trying to do some immediate problem solving for communities in need. I will tell you that it didn't even occur to me to not consider that as part of my day. Relatedly, the health effects of this moment trickle down not just to mental health, but literally to the costs that families are absorbing. So earlier this year, I also had a colleague who is documented, but the family is undocumented. And mom was in desperate need of cataract surgery. Now, as a general matter, this is a low-cost surgery that's generally covered by insurance, but undocumented adults in California and in the rest of the country are both excluded from the ACA, but also low-income programs like Medi-Cal. That's the campaign that I work on, which is to close that exclusion, which I'll talk about in a bit. We didn't even think twice. We just crowdsourced the money, both within our own office, but other people that we knew to pay for like a $7,000 surgery. It didn't even occur to us to do anything different, in part because of what families and communities have to go through to access services, which could potentially reveal their status, and the bureaucracy of even the potential, the bureaucracy that comes with maybe accessing services when in the end you might be denied anyway. All of that, I think, really impacts the well-being and mental health of those of us who are in the movement. I think of myself as a movement builder. Sometimes critically important to my work is storytelling. I don't share the stories of my colleagues lightly, though, because it's really serious, and the consequences that these folks are living with are quite serious. So I wanted to ground us for a minute, just in like my day-to-day, before we go into the somewhat nebulous but important world of policy. So I live in the federal immigration scene. Just for some context setting, immigration sits in the jurisdiction of the federal government. That is why there is such a fight between states and the federal government about how to regulate immigration. Under the last administration, some critical detention and deportation policies notwithstanding, more conservative states were like, we're going to just profile people on the street because we can. They claimed it was a state's right. I'm thinking of Arizona in this moment. Here we are in a moment where we are trying to literally defend ourselves from the White House. It's not about conservative states trying to figure out how to deal with communities of color, their problem on the street, perhaps by way of detention, deportation, trying to determine someone's status just by how they look. That will continue and continues in conservative states. But we find ourselves in a rather odd situation where we are exploring and trying to figure out what protections states can pass, even under the challenge of litigation, because the state of California was sued by the White House and the DOJ, how much we can do to protect communities in California. And that's really central and critical to my work. I did want to just quickly go over what's happening at the federal scene, because I can't talk about anything happening in California without explaining how the federal system, the federal immigration system, the federal policing system, the federal surveillance system makes the work that I do somewhat harder. Oh, I'm sorry. So I wanted to just highlight a few things. We have about 11 presidential executive orders that we are literally, this has resulted a bit in my lawyer friends debating about what an executive order is. Everything from the Muslim ban to preventing rescinding DAPA, which was status for the parents of DACA recipients. Those are all some form of executive presidential privilege that will literally change the way that we think about immigration. At CIPC, I both look at federal immigration, but also the impact of regulatory changes. I'm hopeful that in a minute I can talk about the impact of something called public charge. I know I'm a little bit behind on time. I do want to also highlight some innovative things that the state of California is doing. We should really be proud to live here and really understand what the state is trying to do to protect immigrants, but of course we can always do more. Very quickly, so these are facts you can find anywhere on the internet, but I did definitely want to set the scene. California is home to over 10 million immigrants, and the ACS suggests that that is an undercount, right? Because folks are very worried about filling out the ACS survey, if you've been following the census conversation in the media. About 3 million of those folks are undocumented. It's a significant part of the overall immigrant population in California, which means mixed status families, citizen children's parents are often undocumented and trying to navigate a really difficult system. I hate these facts, but I have to use them in my work in policy. Undocumented immigrants pay $3.2 million into the state and local tax system, but they have no access to the services that a state might provide. $3.2 billion is a lot of money. It is, in fact, the cost of Health for All, which is the campaign I'm about to talk about in a second. 1 in 6 children has an immigrant parent, and 1 in 8 children lives in a mixed status home. We haven't aggregated those numbers. This presentation, putting it together, made me think about how important it is to really have a whole number to round this out so people understand how many kids we're talking about. It's a lot. I wanted to just quickly do an overview of immigrant communities and health outcomes, because it's related both to my work, but obviously to tonight's conversation as well. Mixed status households are 32% less likely to have access to a doctor and 40% less likely to have health insurance. I think this is pretty humbling. Just a quick note that this is a 6-state survey. California was included. I'm happy to share the citations after this presentation. Since 2016, immigrant communities are far less likely to access both safety net programs, but also things like workforce development training, language access training, knowledge about how potentially to become a citizen. So you're seeing a freezing and chilling effect, not just in public health programs, but in programs that would enable a family to integrate into the community in which they live. Our own research, I was a part of this project last year when I started at CIPC. It's called Healthy Mind, Healthy Future. I encourage you to look at it more closely on the interwebs. Suggests that 40% of immigrant children in California have sought or would like to access mental health support, but many don't have access to it even in their schools after having asked. We spoke to over 700 kids when we did that assessment. So California's vision for a California for all. So California for all is Newsom's hashtag. I have to follow both Newsom and other legislative stakeholders for my work, for better or worse. Although the governor's sort of structural budget suggests that there's a lot of relief for immigrant communities, if you peel away a little bit, not only is that because of advocacy and movement building in the state, but also there's like a lot of room for us to do better. I did want to highlight that the California Values Act is the most robust sanctuary law in the country. If you know the term sanctuary state or sanctuary city, raise your hand or have a sense of what it means. Right, so the term itself is somewhat broad. As a general matter, this is what the term means, that the city or state that has self-anointed itself as sanctuary state or city is not going to participate or share resources with the federal immigration system. That generally means ICE. It can mean USCIS in particular circumstances. California has the most protective law. I don't know if cities actually even necessarily have passed laws as opposed to just anointing themselves sanctuary cities. We don't use the term sanctuary state. It doesn't poll very well, but I think the content of SB 54 highlights why all of us should be super proud to live here. There are very clean lines between what local law enforcement and sheriff's offices can share with immigration officials. So there are some exceptions for people who have committed felonies, who are a threat to public safety. We could talk about that all day, quite frankly. But as a general matter, what the Sanctuary State Bill in California does is cut off the information source for expedited detention deportation. It's really important to note that those folks who have spent any time in a detention or deportation have exacerbated mental health effects. Related to that, CIPC and myself, I lead this campaign, are focused on expanding Medi-Cal for all undocumented adults in California per the income eligibility standards that that are already preset in the program. So this year, the governor included young adults in his budget. We're fighting very, very hard for elders to be included with the hope that over time, Medi-Cal expansion for low-income families would be a reality for anyone who qualifies. Related to all of this is, I think, something that's really important, which is the regulatory changes that will impact people's ability to access programs is not only something that we should study, I think, more carefully, but at the moment we are in a defensive fight for public charge. Public charge is basically an attempt to keep low-income families and low-income immigrants out of the country. You are deemed a public charge when you go into USCIS and try to change your status, and you disclose that you have used safety net programs, everything from food stamps to living in subsidized housing. Now, in a city like LA and a state like California, where immigrant communities are literally part of the fabric of the state. The idea that if you were to disclose use of a safety net program, it's also actually rather hard to become eligible for one. The idea that that would impact your ability to change your status has had a freezing and chilling effect, both across up and down the state, but also around the country. I'm really happy to talk more about public charge in the Q&A. My hope was to have spent more time on it now. I wanted to just share a 1-minute video, and I know that I'm over time, that tethers the work to, oh, do we not have time for that? Hopefully, maybe in the Q&A. But I'm here for questions. That was a lot. The system of immigration, both policy and law, is a complex one, and I look forward to talking to you guys more. And sorry for the time.